welcome to Mormon Sex Info. This is Natasha Helfer, and I am just thrilled today to have an interview with Stacey Jackson Roberts. She is the current or new CEO at the Utah Pride Center as of September 1st. Am I correct? 2021. Trying to remember what year it is. And I'm just super excited to have you on to talk about all kinds of things. I definitely want to educate the public on the Utah Pride Center and what you have going on as far as resources and maybe even a little bit of history and what you're hoping, what you would hope to get to the audience. I'm also interested in maybe a little bit of your own personal story, just kind of, I'd love for you to introduce yourself as far as professionally, and also anything that you're comfortable sharing in regards to your own background and kind of what brings you to the space. I believe you have a Mormon background yourself. And then we're going to go into a bit of a discussion about the current climate in regards to kind of the Utah mainstream religion, which is the LDS Church, with the LGBTQ plus community. So we have a lot on our plates, and I'm excited to dive right in. So, Stacey, why don't we start with your introduction? Just tell us a little bit about yourself, where you come from, and your professional status.
Sounds great. So, yeah, I grew up here in Utah in the little town of Beaver in a Mormon cattle ranching family. My grandfather, before he was passed away with my uncle that I was originally named after in a farming accident in 1980. So, big family farm, and my grandfather was a Mormon bishop. So, very staunchly LDS family in my background. My mom was a convert. She converted while she was going to school at Utah State University and became a home ec teacher, moved to Beaver, and that's how she met my dad. I grew up down there, graduated high school early at age 16 in 1999. So just as a kind of a context for that era, Matthew Shepard was killed the previous fall in 1998. So just kind of the era that I was growing up in. I went to Utah State University and earned my BS in Law and Constitutional Studies back in 2003. And moved back to DC, and I've been there first working in healthcare policy, including for Senator Ted Kennedy, and then changing careers by getting my MSW at Smith College School for Social Work and becoming a therapist that has worked primarily in gender sexuality and particularly building out LGBT dedicated lines of service at FQHCs in the Baltimore, DC area, and also having a small private practice on the side. So that's how I kind of entered this realm. It was my sister had a baby 2 years ago at 26 weeks gestation and was in the NICU for 107 days, and I didn't get to meet that little baby for 14 months because of COVID. And I'm just like, it's time to return home, and there's some really important work for me to do in Utah. As an out transgender woman, I think, there are things that are ripe for addressing. I saw Spencer Cox, the governor, get quite emotional over trans kids in the spring and at press conferences. I'm just like, this might be the time for me to return and do some important work.
Okay, that's amazing. So so you've been out east for a while and just recently then back in this kind of home state of yours. So why don't you give me a little bit, or the audience, a bit of a history of the Utah Pride Center and what you know about it kind of prior to you coming, and then maybe some of the things that you're interested in putting your stamp on.
Sure. So the Utah Pride Center is entering its 30th year of existence. We have been the primary community and resource center for the state of Utah for the past 3 decades. That, most people have the perception of us as the Pride Parade and the Pride Festival and whatnot. And that's a really critical aspect, to really have that community space to come together and whatnot. But that event is really what helps to support our other services throughout the year. So we have behavioral health services or mental health services here, along with suicide prevention services, youth and family services. Amanda Darrow is our director of youth and services and works directly with GSAs, particularly as they're forming in Utah schools and whatnot, advocating with the school boards, the state school board, whatnot, around policies to help make schools safer for our LGBT.
Let's not assume that everybody knows what GSA means.
Sorry.
No,
Yes.
that's fine. I had a kiddo who was in their GSA at school in Wichita, Kansas, loved it. It was a big part of their experience growing up. So, but please, yes.
Yes, GSA stands for Gay Straight Alliance, and so these are really the in-school organizations to help support LGBT youth, and really also really help prevent suicides. If have that source of community and inclusion is really critical, and so we're trying to help support those throughout the state. Sometimes there's a lot of administrative resistance to that, and but I'm also really heartened. We just had our road rally 2 weeks ago, and there's a newly formed GSA in my hometown of Beaver, and we support
Wow.
a teacher at bringing up a carload of those students, and the feedback was that they've never felt so loved and affirmed, and it's just really heartening to see kind of that evolution that these youth can be supported and feel included.
That's amazing. Okay, so I didn't mean to interrupt because I know you were talking about like a lot of the resources, right, that Utah Pride Center offers, and you were talking about supporting GSAs in the school. But you were also talking about maybe family intervention. And so what else? Like what if you were going to walk through all the different services, what are we
So
talking about?
we have a lot of more peer-based support groups as part of that, and then we also have our SAGE program, which stands for Service and Advocacy for GLBT Elders. So that's really our programming dedicated to serving the aging population, our senior citizens, our noble elders that really have fought bravely for our rights for many decades before us, and so really tried to help support them in many ways. And then our mental health services right now. As you noted, I have been here for just shy of 60 days, and I've hit the ground running, do a deep dive assessment of the services here. And so I believe right now, because of that deep dive in the internal review, we're going to pause temporarily intake services as we try to bring some of those services into line and make sure that we're providing the best quality care possible. And so that was part of the reason why I was brought in. I'm a clinician at heart and really dedicated to good ethical services around gender and sexuality.
Okay. So the Utah Pride Center, I mean, when I think about it, I think about this building downtown Salt Lake City. I've been there a few times myself. And is that primarily where everything resides, or are there other kind of, oh, what do you call these? Like, what is it called when universities have like different satellites, right? Satellites and or remote services.
So currently, it is primarily based right here in Salt Lake. COVID has taught us that we can offer a lot more virtual services, and so that's the other aspect as to why I was hired. Is being from a rural area, I want to really expand the services that we can offer rural communities, whether virtually or through a mobile center, or even also partnering with other organizations to have more kind of brick and mortar satellite opportunities throughout the state of Utah. I had intended to do a listening tour much earlier in my tenure here. It has required much more attention here on the ground to try to bring some of the stuff in line here at the center. And so we're going to be announcing our reopening for at least in-person services here at the Pride Center in early January, which will follow with a listening tour of the state where I will travel the state through January and early February, listening as to how we can better serve the entire state of Utah. So that announcement and more formal information around that will be coming out, but the plans are in the works.
Okay. And when you're talking about in-person services, then ideally there would be some counseling services that would be available at your center, including group sessions that people could attend.
We are currently still offering in-person services on appointment basis for mental health because of the critical nature of that. But the other general like group in-person services have been closed, and we've really moved mostly to a virtual format because of COVID. And with COVID, we did do some downsizing in staff, and so we're going to be restaffing so that we can actually open our doors to the community. The staff here has really been phenomenal in providing basically the services that a staff of 24 were providing before, with a staff of about 15. And so I want to give them credit for the work that they've been doing over the past 18 months during the pandemic to really meet the needs. And so we will likely be closing our doors for 2 weeks in December during the holidays to allow our staff some respite, and so that we can come back in January with that grand reopening and really hit the ground running in providing services to our community.
And as you're talking about being able to staff people, what can you explain a little bit about how the Utah Pride Center is funded, and when, if people want to donate, obviously I know you have a lot of fundraising, interests. What's the best way to go about that, and how are those monies kind of managed?
Yes, they can go right directly to our website and donate online. We are audited on the regular. In fact, we're going through our audit process right now. And with two cleans sets of books, we will be able to go for big dollar money, basically, with big foundations and whatnot to contribute to this work. One of our biggest funders is Bruce Bastian and Clint Bastian. They really fund a lot of our clinical services. And then one of our primary funders is Bino Solomon out of Park City, who our building was basically gifted to us because of her. And so we have a lot of individuals that have really kind of stepped up to the plate to help create the infrastructure for us. And that's part of what I'm here to do as well, is to figure out how we actually plan for longevity and bring in different types of revenue streams. So right now we're in the process of developing a director of suicide prevention and community education, which will also build out that continuing education programming, so that that's another revenue stream, but we're also educating other providers in the community around how to provide good quality care for the LGBT community.
Yeah, like I saw one of the emails I got from your center from you was suicide prevention CEs that were actually offered for free. And that's happening. When is that happening?
It just happened this week.
Happened.
Yes,
Yes.
five CEs in suicide prevention. We brought in Kurt Woodring from the East Coast, and really phenomenal training. And unfortunately, it was fairly last minute, and I wanted to get that out there, so we did make it for free. And that new position will be really dedicated to building a really robust continuing education program. So it won't, it's haphazard.
Yeah,
So
no, that's good. I mean, yeah, I know about haphazard. A lot of times you just got to put it out there. Get started at least, and then it gets better over time. Are there other resources in the community that you partner with, or that I'm thinking about like the LGBTQ Guild of Utah practitioners. I know that there's not maybe official partnerships, but are there other resources or things that you would want the public to be aware of that the Utah Pride Center partners with?
we partner with a lot of organizations, and I really want to actually try to break down more barriers that are often, as a therapist, I suspect you've seen this, with trauma, there's often a scarcity mindset. And so sometimes different organizations that really are trying to do really phenomenal work have a history of seeing each other as competitors. And so I really want to build relationships with those organizations and have a seat at the table with those. See things as less stay in your lane and more of a collaborative effort to benefit the LGBT population of Utah, and particularly a more intersectionally focused endeavor. We've got a partnership with PICTAR, which is the Polynesian organization here in the state of Utah, that is really phenomenal, and I really am excited about the work that we're doing with the Polynesian community. And so there's that. Had lunch and have worked with Stephanie quite a bit with InCircle, and they are doing phenomenal programming at their houses and soon to be open houses throughout the state of Utah and Mountain West. So InCircle is really a critical resource in many communities locally, and really doing phenomenal work there. And I look forward to partnering with them around a lot of different services. So.
Well, so what can you tell us at large? Like, how is the LGBTQ plus population doing in Utah? What are kind of some main statistics that you want to maybe share with us? I know that in the circles that I kind of listen in on podcasts and things like that, there's always a concern about the LGBTQ plus homeless youth in particular. Yeah, so maybe just in general, what would you share with us about the population and its health and its concerns right now?
I think there's a lot of challenges, and I'm less familiar with the current statistics. So sometimes data is often lagging, and we need more data around that. And sometimes there's institutional challenges around collecting that data. Youth homelessness is critical. The majority of the homeless population of youth are LGBTQ identified, and so my vision for the center is actually growing to a space that we can actually provide transitional housing and moderate to mixed income housing, housing for seniors and whatnot. So I think there's a lot of different needs depending on the unique demographics of our LGBT population. And that's part of the 5 to 10 year plan down the road as to how we actually meet those needs. Additionally, when I was talking to Stephanie, it's ironic, both of our organizations, about 70 to 80% of our population is trans or non-binary, and that's a particularly challenging population in this state, particularly with some hostilities from various corners. And so making sure that we're able to meet the needs of that population and prevent suicide is really critical. With broadly speaking, the transgender population has about a 42% attempted suicide rate at some point during their life. And so really making sure that we are addressing the intersectional binds of oppression so that we are curbing that rate is really critical to me.
There's always a lot of speculation or, some controversy in regards to whether or not Utah's risk or high numbers on youth suicide has to do directly with the Mormon church. So if you've got this non-affirming kind of fairly antagonistic, church that is addressing people in certain ways, does that have an impact on suicide or not? So I'm not necessarily expecting you to have the answer to that, but what would you say in regards to that particular concern?
I think it's one of many factors, and it's a critical one. As somebody who grew up in the dominant faith and was internalizing those narratives over a lifetime, I love my parents, but I also know that some of the things that were said growing up were why I stayed quiet for 24 years. I came out at the age of 24, and so that my mom knew it wasn't a phase, I had a picture from a magazine article from 1998 that was hidden behind a picture on my wall. I said, go back and look. It's been there for years. This isn't a phase. And, I graduated high school at 16, not because I was particularly intelligent, but out of a need to survive. The two final terms of my 7th and 8th grade years, I had to be homeschooled after very violent incidents, and one where I was nearly killed in the locker room of the high school. So there's different cultural aspects that when people say certain things, it gives license, or people perceive it as giving license to enact physical or verbal violence towards people that are different. I wasn't out when I was growing up, and yet people, were reading me as not conforming to certain expectations of gender, and therefore socially penalizing me because of it. And that gets internalized. It does cause mental health challenges.
You mentioned now on several occasions multiple factors. What would you say are some of the other factors outside of religion that contribute to some of these challenges that people are facing?
I think it's access to services. Kurt, the trainer this week, had an infographic of the United States to show the rates through the Mountain West versus other places. Utah is a very rural area with access to weapons and a culture that involves that, and access allows for it. And then the lack of services. If we're looking at Maryland or Massachusetts, Maryland has Shepherd Pratt Hospital, Johns Hopkins, all this robust mental health system. And Massachusetts has Austin Riggs and McLean Hospital and the Brattleboro Retreat, all these really phenomenal hospitals, plus a robust outpatient and community-based mental health services that really help support that. Whereas, when I was growing up, there weren't school psychologists or even a school nurse in any of my schools. I'd be hard-pressed to identify a therapist other than the actual DSS social worker in my community from when I was growing up. I think that's evolved some. I think some of the community mental health departments have some services in the rural areas, but not having access to that is really critical. And so feeling isolated and alone is feeding that, I believe. And so you add the intersectional component of being LGBT and not conforming, not fitting into the dominant religion and their narrative. It's, if the lowest kingdom is paradise beyond paradise, it almost becomes an incentive. Why continue, right? And so I think it does our community a disservice, right?
So you came in to this position, I believe, right around the time, maybe just right before, right after, I'm forgetting when this talk happened at BYU, but there was this, this address given by Elder Holland to the BYU faculty in regards to standing up for what the Mormon Church believes in particular. He called out LGBTQ plus issues. He spoke about a prior valedictorian who had given a speech at BYU that was previously, what do I want to say, okayed, right? Like it was given the okay, but he still called it out and, in a sense, was almost threatening funding to certain departments if people didn't start standing up for the LDS perspective on gay rights, transgender rights, etc. So did that trickle up to Salt Lake City and the Utah Pride Center? I'm guessing you had some sense of that happening, and I'd be curious to know kind of some of the conversations or concerns, or if there has been any type of outreach to the LDS Church, etc.
So there are different entities, and I think that's the challenge, is trying to delicately navigate these spaces without stepping on toes, because there are certain entities that see their role as more of that engagement directly with the LDS Church and the political circles, if you will. And so trying to hit the ground running without stepping on toes is sometimes a challenge. I have not directly reached out to the LDS Church currently. I hope in the future that is an opportunity to have discussions. But the narrative used, does give license. When you're talking about musket fire, it does give license to certain segments of or at least it perceived license by many, to act out in violent ways towards segments of the community. And we did see a surge in people requesting services here through our mental health department. I won't give the exact number, but our wait list ballooned quite substantially. And that was my first clinical meeting sitting in on. And our therapists were under quite significant distress, processing their own parallel processes, often coming from LDS communities, but also those that don't come from LDS communities. Just generally the trauma of sitting in the same space and really hearing some of the things that people are experiencing because of that narrative can be quite distressing for the therapist as well. And so I think that's part of the challenge is we are hearing it, and there's need. And so right now we are in a phase of assessment and trying to expand the services that we grow here, but I want to do so in a way that makes sure that there is good quality care and not just simply providing therapy in a way that could actually cause further harm. So we're going to be growing, but there may be some pausing on some of our services temporarily as we address some of those challenges.
Well, I know that in my position as a clinician, I have oftentimes indirectly, encouraged the Church of Jesus Christ of Latter-day Saints to become trauma informed, to become LGBTQ plus informed in regards to national statistics, resources. We know that communities that are non-affirming do struggle with higher suicide rates, mental health symptoms, homelessness, substance abuse, etc., in regards to LGBTQ plus populations. So if by chance, you had the opportunity to speak with, some of the leaders from the church, what would your hopes be as far as the types of resources they might be open to, or trainings, or anything in regards to accessing resources that already exist?
I think I would have them meet with both individuals who are LGBTQ, particularly trans. I think that's the area that's going to be our big sticky wicket going forward. As in certain ways they've become more receptive to gay and lesbian and bisexuality. Still got a long ways to go there. I don't want to leave the perception that I'm saying that they're good there, but still got some growth edges. But I think part of it is kind of meeting an empathy. In some regards, I feel sorry for folks that really aren't able to connect with the really amazing and beautiful people that are part of the LGBTQ community. And I think as people start to really get to know folks that are LGBTQ and start to challenge a lot of their underlying assumptions, those barriers start to come down. I mean, we had a Republican governor in tears, at least hinting that he was open around trans kids. And so I think there is room for growth as people really start to relate in personal ways rather than some of the narratives that Hollywood, Our conservative state loves to rail against Hollywood. Let's rail against Hollywood for a minute. But there's a beautiful documentary out there called Disclosure on Netflix that really highlights how Hollywood has constructed certain narratives around particularly trans identities. And so we're not the scary people that Hollywood has made us out to be. And so I think there's a lot of different opportunities there as people really start to learn our lived experiences. And I think the science actually is on our side. Some of my phenomenal colleagues, Elise Pine is a pediatric endocrinologist back in Maryland, who I had her do a little bit of a write-up when all this started to hit the Mormon feminist pages back in January. And I'd already done an Ask Me Anything back about 2 years ago for the Exponent 2 that, I spent 12 hours one Sunday doing an Ask Me Anything in their social media group, and it was really a beautiful process to see kind of people come full circle to challenge some of those underlying assumptions, and then also to be able to point to medical doctors that are talking about how this really shouldn't be a concern around trans athletes and things like that, and challenging some of those assumptions as far as risk and things like that. So
What can you speak a little bit more about the assumptions you're referring to? So in other words, what are some of the kind of myths or ideas that people are struggling to understand, and then what's the information that's disseminating some of that?
Well, I think part of it is understanding the standards of care as far as accessing care. I think many people have perceptions that kids are going right out and getting surgeries and immediately getting on hormones and things like that, when there's a lot of gatekeeping involved in actually accessing medical care. Second is also the physical abilities of trans people, and particularly when you're dealing with youth before Tanner stage 2, there's little to no physiological difference in ability between a trans girl and a cis girl. And then it's a Tanner stage 2 that we would potentially add puberty blockers or hormones, and if they go on hormones, they would be developing in line with their cisgender peers. If they're going on blockers, then their cisgender peers are continuing to develop, and they're not developing at that same rate, if at all. And then also, if you've gone through puberty, I just do not have the stamina or the strength that I once did. And there's wide-ranging overlap. I challenge you to go out and look at any WNBA team and look at how many cisgender women, or at least presumably cisgender women, are, 6'5", 6'8", and whatnot, and a certain size. I have a good friend from high school, Sadie Waters Best, who lives down in St. George, and she was in these groups. I said, Sadie, do you remember me in high school and how slow I was on track? I might be 6'2", but I was not a competitive athlete. And she's this little petite thing, and she's like, yeah, I would beat you by a long ways. So, I think that's just it, is people perceive size as often in line with athleticism or ability or strength, and that's not always the case.
And it completely ignores the intersex population, where that's even more complicated, right?
Exactly.
Okay. Well, going back to, the Holland address, which I was very concerned, because I agree with you that whether it's perceived or intentional, it does give license. I remember, I just want to share that even in my own extended family system, we have a non-binary family member, and they, things that I thought we had negotiated a year or two ago with LDS family members came back into question after that talk, as far as I think family members feeling that call to stand for what is right, in their perception. And so I had to make some comments about, well, I also have to stand for what is right, as a parent, and also in my theological, perspectives. And, we've gotten, I think, back to a place of being on the same page as far as supporting our non-binary family member. But it was concerning to me that, just in my own family, it trickled down. And I just think that that's something that, community members should probably be aware of. Is there anything in regards to those kinds of situations that families are in that you would want to speak to, as far as how to advocate or be an ally for either lesbian, gay, bisexual, trans, intersex, non-binary family members, your children, your adolescents, especially dealing with extended family members, many of whom could possibly be LDS in this dominant culture. So you've got your Mormon grandmas or grandpas or aunts and uncles who are concerned, who are usually intentionally coming from, a loving space, and yet can be fairly harmful in regards to supporting and being allies to their grandchildren or nieces, nephews, etc.
I think first starting from listening rather than presuming that you know, trying to understand the experience of your LGBTQ family member first and foremost, rather than asserting your own thoughts and feelings and narrative. Because this is a person who has trusted you enough to at least disclose who they are and try to be more authentic with you. And trying to challenge that directly is going to shut down that process likely. I think there are some phenomenal resources out there as far as organizations and whatnot doing some really good work. The Family Acceptance Project, I think, is really critical. Caitlin is another Smithy. Sorry, I'm loyal to my alma mater. Caitlin Ryan really has a phenomenal program through San Francisco State University and whatnot. Mama Dragons, reaching out, in Circle, in having lunch with Stephanie, she related that she saw In Circle as a way to bridge that gap between folks that are coming out of a tradition that hasn't been all that inclusive and coming to a place like the Pride Center might, at least in the initial phases, be a bit overwhelming. And I related to that. When I was first coming out, that internalized transphobia and homophobia was so great that I could barely walk by the LGBT Health Resource Center at American University where I was working in DC. And it took a couple times before I could even walk in that space. And so having that opportunity to really have that space that is a bit safer for folks as they're trying to figure this out and how to best support their kids is really critical. And we as the center here need to be accessible to the non-LDS population and to LDS population altogether. So I want to address cultural competency issues there and make sure that this is a welcoming space for all as well. But I also understand, pride flags everywhere and stuff like that may be a bridge too far initially. But anyway, so.
Yeah, no, that's accurate. I think it's a process, right? And then the other thing too that I think is important to share is that there are many LDS families and parents and who are very affirming. I was just speaking with a couple and they're temple going members, and they also attend the monthly drag show of one of their kids, and support them in that whole process and feel really good about that. And they don't seem to have any issues in regards to their local ecclesiastical leaders being upset with them about that or anything like that, which speaks a little bit to the roulette, right? What we call the bishop's roulette, that sometimes you get in trouble in certain ward environments for certain things, and then in other ward environments they're seen as totally supportive. But I do think that even with the work of Jana Reese and statistics, that the LDS population at large is becoming more affirming. And in fact, the millennials, very much so. I think a big reason, unfortunately, why we lose a lot of our millennials or younger generation folks from the Mormon tradition is because of social justice issues, and they don't see their values being aligned with discriminations that maybe some of the older populations are more comfortable with, because that's unfortunately the history of the United States. But is that your experience as well, as far as just as even members of the church kind of being more affirming in general? Again, I'm not expecting you to know statistics necessarily, but just kind of your lived experience.
Yes, like I said, the 20 years that I've been gone, I mean, I've come home to visit and whatnot, but things have evolved in significant ways. But I think it talked, I mentioned this on one of the news stations when I was preparing for Road Rally, but part of that is also this arc. When I first came out, my dad really struggled. It was a really difficult several months and even years. Took time off of work just to mourn basically when I had surgery and things like that. And my mom was there for every surgery, but was scared of being excommunicated, and so she wouldn't put a penny towards it, but would be there to support. So I made sure that I did did my due diligence in making sure that she didn't have to spend a penny, but could be there to help support me. And yet also the full arc of that is, as I was here interviewing in July, I'd driven out here, I left the car here, left my dogs here, but they flew out and helped me get my house in shape and get ready to move back to Utah. They were, my dad and I were in there doing heavy construction on my house, getting it ready to sell. And so there's this really kind of beautiful arc as families work through that together. It's a challenge, and I do recognize my parents grew up in a different era. My dad's side of the family, that's very much Mormon. My mom's side is not. My mom's side is very, very affirming. My dad's side has really struggled, but particularly the parental and grandparental generations, whereas cousins, much less of an issue, and particularly actually my male cousins have much less of an issue than some of my female cousins. So anyway, which is not what I would have presumed. So anyway.
Yeah, really interesting for sure. Well, Stacey, I always ask at the end of pretty much all of my interviews, like, what am I not asking, right? What are you hoping to say, or what were you hoping I would ask? Or is there anything in particular that I'm missing from the conversation that you'd like to make sure gets put forth?
Not that I can think of. I'm just really excited to be here. I see a lot of growth opportunities for the Utah Pride Center, and just me personally, I'm excited to be back and be part of Utah again. So please, if you're listening and you're seeing an opportunity to get involved with the Utah Pride Center or partner with us, please reach out. I'll figure out a way that maybe we could do a tour of the center, or anyway, reach out. Let's see what we can do to partner and make Utah a more affirming and accepting place.
And I'm going to plug it one more time just because I feel like it's so important, but please make your donations to support the Utah Pride Center as a nonprofit that I think is just doing such incredible work in the state. And they can do that at
www.utahpridecenter.org.
For sure. I think that this is one of those organizations that I always try to support. I've done the road rally. I did the road rally last year. It was phenomenal. It was so fun, especially since COVID was, so sad for all of us. So at least we got to go out in our cars. I had a scheduling conflict this year, so that was really sad that I missed it, but I'm excited to be part of it again. And the Utah Pride Parade, of course, we were both my non-binary kid and myself went and marched in that. That was super fun as well. So, and
full Pride this year. So
what?
We're planning to host a full Pride this year.
Oh, good. That's exciting. And me too, coming back. I mean, I just moved here at the end of 2019. I'm in the Mill Creek area, tons of pride flags, tons of just really affirming, trans flags and, other kinds of, even the non-binary flag I see from time to time. So it's exciting to see the shifts and changes in at least the Salt Lake City area. I know that rural Utah's looks a little bit different in regards to some of these issues. But I mean, when I went to BYU 30 plus years ago now, Salt Lake wouldn't have looked like that either. So there's definitely that arc you're speaking of that I think is very, it's heartening to know that we are making more room, and yet there's a lot of work to do in regards to our LGBTQ plus, both members of the church and obviously people who live within the state that are affected by the dominant religion kind of narrative. So, yeah. Well, I thank you so much for your time and spending that with us. I'm just excited to get to know you more, and hopefully our paths can cross as we're both in this area now. So that would be great.
Look forward to collaborating. Thank you.
Thank you.
Thanks.
We took the long road home, turned minutes into miles, and as the evening traveled on, the sunset bathed your smile. We stopped beneath the desert stars, wrapped in each other's arms. Was it simple as I love you. An ordinary, extraordinary truth.
It's been a long road here, a trail with tears, pain and sorrow too.
But through every storm we traveled on, like lovers do. And if sometimes we fell apart, we always came back home. Was as simple as I love you. An ordinary, extraordinary truth. Some people say love is blind and forever is too long. But I see your eyes in every sunrise. Can't imagine life alone. Let's take the long road on together until we're gone. Want you by my side till the day I die and into the beyond. It's as simple as our love is. That's how I wanna go, all wrapped up in the arms of our extraordinary, it's nothing ordinary love. Ordinary, no, it's extraordinary love.